Hello and welcome to the Community Voice. I'm Fara Sachs. My guest today is Dr. Michele Taubman. She is a vascular surgeon with Miami Vascular Specialists. She describes herself as a plumber for circulation.
That's right, Fara.
I love that. Welcome.
Thank you so much for having me. I really appreciate it. It's wonderful to be here.
And so I appreciate you being here too. And I've had two of your colleagues with me, Dr. Libby Watch and Dr. Sukas here, and we talked all about veins and health of veins and treatment of veins. And this is the first time you're with me, so I really appreciate you taking the time out of your busy day.
It's an honor. Thank you for having me.
And you have such an illustrious background. I'm gonna just gloat for you. I'm gonna be your mommy for a couple of minutes. You grew up in Maryland. You went to the undergraduate at Emory University.
Yes.
You went to medical school and general surgery at University Medical School at Jackson Memorial.
Mm-hmm.
Wow. Your vascular surgery fellowship at Emory University, and you joined Miami Vascular Specialists in 2015. And to boot, you're fluent in Spanish.
Es la verdad.
Wow, you're my shiro.
Thank you.
So tell me what you do on a day-to-day, and you know, why vascular surgery? Like, you could have done anything. And where did that come from, that passion? Is that something you were born with when you were a young girl? Like, you were like, remember the game of Operation?
I have to say, with the game of Operation, that loud buzzing scared me a little bit, like it did for a lot of young
too.
people.
That's why I didn't go into medicine.
Yeah, well, you know, my father is an internist in Maryland, where I grew up. He's still in practice, taking care of his patients. And it was very natural for me when I was younger to be involved in medicine. As a little girl, I would go to the hospital with him to round on patients. I'd be in his office for many times. And it really just felt very comfortable and natural for me. I loved science classes, you know, throughout high school and in college. I was a biology major. And I love people, and I love interacting with people and their families and getting to know them very quickly and very intimately and helping them. And medicine provides that pathway for me. And I was a gymnast growing up, so I'm used to very high, you know, fast-paced, lots of movement. And in surgery, you really get to have some quick results with your patients.
But you don't do plie, insert, plie, cut. I mean, releve, you don't do any of that. You didn't bring your ballet shoes into the operating room, right?
No, but you know, gymnasts are very disciplined people, and they know how to work as individuals and as a team. And I really think that helps me in my practice and taking care of my patients. So it was just very natural for me to follow the track of medicine. And surgery is the best of all worlds, where you get to help people be dynamic, creative. Half of what I do is endovascular therapy, which is catheterizations and looking at, you know, monitors, and it's similar to playing a video game. And the other half of what I do are making incisions and, you know, cutting people to provide more blood flow to areas that need it, or stopping bleeding if something's bleeding. So I really think I went into this field because it's just so diverse. No day is the same. And I love my patients.
I get that feeling from you. So your work involves, some of them are life-threatening. And then there's the other side that's just, I want to feel good. I want to feel good about inside my body, make it look as good as possible, more in a cosmetic sense. Differentiate that for me.
Sure. Yeah. In one day, I could have a patient coming in with a ruptured abdominal aortic aneurysm, which is a true emergency where 75% of those patients don't survive, and we can save their life. And that's incredibly rewarding. But on the other hand, look, we live in Miami. We're allowed to be vain about our veins.
Oh, look at you. Not only you're a plumber, you're really a comedian, too.
Well, thank you. I try. So, you know, we want to feel good in our bodies, and I want my patients to be able to go to the beach and feel comfortable. And some of our patients really just need some little cosmetic injections, which is very simple. And we'll talk about that more later, I'm sure. Other patients of mine, because I know today we're focusing mostly on venous disease in the legs and how that looks. Some patients have more severe problems related to bad acting veins, and they have ulcers and terrible swelling, and they really struggle on a day-to-day basis. So you know, our practice is all about doing what's right for the patient, whatever it is that they need. And we really give individualized care.
So it's a comprehensive approach for the practice. So there is that, you know, life-threatening, and then there is that cosmetic, and you bridge both of them within your organization and the practice.
Certainly. And when it comes to lower extremity vein disease, that's the difference between our group and a drive-by vein clinic. You know, we're really looking for your best interest and keeping in mind what your body's going to need now and in the future, and what the best approach is going to be for you.
What does a drive-by clinic mean? Define that for me.
It's very easy to find places that are offering to get rid of veins and do ablation procedures. All of us have saphenous veins, and it doesn't mean it's a bad thing. Just because you have a saphenous vein doesn't mean that it needs to be taken out or shut down. You will find that some people capitalize on this fear of telling people, oh, you have a vein, we need to get rid of it. That's not always the case. I mean, if it isn't broken, don't fix it. If someone comes to my office and has no symptoms whatsoever and tells me that they went to an outside facility, that one of these drive-by clinics, and was told that they have reflux in their veins, which means the valves in the veins are incompetent and not doing a good job. But if I then talk to them and they have zero symptoms, meaning their legs aren't swelling or fatigued or tired or feeling like there are ants crawling or needing to elevate their legs at the end of the day, if they have no symptoms, these people should not be getting interventions. And that's what you need to be careful and mindful of when you're out there.
So tell me about the function of the valve, because we're gonna hit the ground running with our with the presentation. So tell me about the valve and its function.
It's all about the valve. So within our veins,
it's like a T-shirt. It's all about the valve.
That's right.
The valve. The valve.
So we have these little one-way trap doors. They're supposed to be very delicate pieces of tissue in your vein that open and close and allow the blood flow from your foot to travel, for example, all the way back up your leg and back to your heart. Veins return deoxygenated blood to your heart, where it originally came from. So what prevents the blood in my legs or your legs from kind of going with gravity back down to the floor? It's these little valves that open and close and open and close. Over time, as we get older, especially in us women, and it can run in our families, these valves can become diseased. I think we have maybe an example of this. That is a very unhealthy, ugly-looking valve. So that's causing problems for that patient. It's like trying to drive home on the Palmetto and cars are going in the right direction and cars are also going in the wrong direction all of a sudden. That door isn't closing and blood is now backing up and causing congestion. And I can go through some images of what all of this looks like.
Let's do it.
Let's do it.
What does it look like? Wow.
So we've jumped ahead to a very extreme version here. This is a bodybuilder, and you can see that he has what we know are varicose veins, those big ropey varicose veins. But how did he get there? Let's go through more of the progression so you can be on the lookout for...
And I actually thought that this was going to be healthy, having this, because it's just because he's pumping or because he's not drinking enough or his diet has changed, but it's unhealthy.
It's unhealthy because venous insufficiency causes venous hypertension, which stresses the entire venous return. And this guy doesn't have it now, but he could evolve to have thinning of the skin, ulcerations, infections, etc., or fatigued legs. So let's keep moving and we'll go back to the beginning of the evolution of how this occurs.
Sure.
So these are spider veins. You may be familiar with them, Fara. I certainly am.
I just looked down.
So these are the spider veins that often first start. It doesn't necessarily mean you have a problem with your valve, but it could. So what comes next after this? These are reticular veins. See, they're a little bit more pronounced, purple raised. This then progresses on to, I don't know if you can appreciate that bulging bluish vein behind this gentleman's knee. This is a varicose vein.
I can appreciate it. I'm glad I don't have it.
more varicose veins at the lower leg.
So this is a progressive thing. It's not just one day you wake up with this, but it's just
That's correct.
This insufficiency goes over time.
Yes.
And is it problematic? Do we need to address it when it gets to this point? Or can we leave it alone and say, you're not bothering me, I'm not bothering you, other than if I have symptoms?
Well, let's see what keeps happening with some of... So here is more progression. You can tell that this patient has swelling in his legs because he wears compression stockings, and you can see in the mid lower leg, there's an indentation line from where he was wearing his stockings. So this can progress to swelling in the legs and skin discoloration. And here, now this is what we're really trying to avoid, where people have skin breakdown and ulcers. This is more concentrated veins at the ankle area. It's called coronophlebotic tactica. And here, this is pretty extreme. This is a gentleman who has the chronic swelling, the skin discoloration, his legs feel like leather, etc. So, I mean, do we need to treat everybody who has a varicose vein? Of course not. But we should start thinking about prevention measures to prevent things from getting worse.
Okay, let's see what that might look like. Compression stockings, huh?
This is one of my favorite things, Fara. And
all I know is when you're on an airplane for a long period, I took my mom on a long trip, and I remember that we went and she wore compression stockings, and wow, and it was so uncomfortable for her. But why would we wear compression stockings?
So first of all, the trick is finding the right compression stocking. And I strongly encourage people to go to a store where they will take your measurements so you can get the right pair, because it really shouldn't be terribly uncomfortable for your mom. If anything,
or anybody.
I wear compression stockings every day. I'm actually wearing them right now.
Ooh, I won't tell anybody.
They look like pantyhose, perhaps, or tights, but you know, wearing compression stockings gives your leg more energy. It has a mechanism built into it that it's acting like your calf muscle pump, so it is helping to return the blood flow to your heart, and it really gives people like some more pep to their leg. And if your compression stockings are falling down, then they're too loose. If they are so tight that you are really suffering at the end of the day, then they're not right for you either.
Okay. That's
compression
good.
Stockings aren't going to take away necessarily the varicose veins that you have, but they will prevent things from getting worse.
And what are the other options that we're going to be talking about as well?
Well, so sometimes compression stockings aren't doing it, or they aren't cutting it, and you come to my office and we talk about other options. So yes, this is a picture of sclerotherapy. This is for those spider veins, and a lot of these patients respond very well when we inject a soapy infusion into these little baby veins, and it's great at getting rid of them. You know, sometimes they can pop back in other places, and we'll address them as they come along, but this is very well tolerated in the office.
And is it, so in other words, you cure the problem for that particular area, but it can go to another area? Good
question. So as we'll also talk about, we need to first, when I see a patient like this, I'm going to do a full examination.
I was going to ask you, the diagnosis.
I'm going to do a full exam, get a good history, and I'm going to likely perform an ultrasound examination on the patient, which is going to tell me, does this patient have a problem with their valves or not? If they don't have any problems with their valves, these spider veins are just part of our aging process, and I can get rid of them with those injections and tackle them whenever they come up. Now, let's say I do the ultrasound and I recognize that someone does have a real problem with those valves that aren't closing all of the way. If that problem is in their superficial venous system, I'm going to offer a different procedure to get rid of the underlying cause of these skin changes. So that's also important. You don't want to just go to a place where they just, you know, inject these guys without checking for an underlying cause, because they're just stealing your money and these will come back. But if once we've ruled out any underlying venous insufficiency with the valves being incompetent in your veins, then we can go after these and tackle them. And it's really fun and gratifying, and the patients love it. I think we have some videos.
I don't know if I loved it when I did it, but I did it because I knew the result was going to be something I was going to be happy with.
Okay.
So here we go. So they're being injected. So do you anesthetize the area?
No, this is such a teeny baby needle that you barely even feel it. I hope you can appreciate that those red veins that were there are slowly, gradually going away.
Abracadabra, look at it go. Wow.
Yeah, really, really fun. A lot of times after we inject them, they do kind of go through different phases where then they may reappear and be, it's an irritant that we purposely inject. And then gradually over the coming weeks, they soften and slowly fade away. And I think there's a separate video that we can go through as well.
Great.
It's so fun to do these, I have to say.
You seem excited. I think I would be really happy eating a burrito. But
look at that. See that blue vein disappearing?
Wow, look at that. Wow, look at that.
Yeah.
And
yeah.
I'm sure the patients just love this because it gives them a whole new lease on life, knowing that there's not really a medical major problem, but more of a cosmetic look, and they can enjoy the beaches of Florida and enjoy that, because it's an important feeling to be good and feel good inside your body.
I agree. And I love also reassuring patients when we do that ultrasound, if I can tell them that there's nothing dangerous going on and we can just focus on making them feel better.
And how many sessions does one need?
Probably a few. I mean, as you can see here, there are often many of these veins in multiple areas. So it's really, again, an individualized therapy and whatever works for that particular patient. Some patients, we get things taken care of in one session, but for a lot of them, it come back for 2 or 3 sessions.
Oh, that's wonderful. Do we have more to watch?
I think we're done with videos.
Oh, good. Oh, good.
I'm sorry,
Go
Fara.
ahead.
I was just going to say, remember we saw some of those pictures of the ropey varicose veins?
Yes.
So sometimes, just injecting those isn't going to cut it because it would suck up so much of that medicine, and then you'd have like this hard little lump under your skin. So sometimes we do another extremely minimally invasive procedure in the office that's very well tolerated, where we do give a little bit of numbing medicine. We make a tiny incision smaller than the pinky fingernail, and we go in and we fish out these veins and we pull them out like spaghetti, and that's called a stab phlebectomy, which you see here.
Is there a downtime on that?
No, the patients do great. I mean, these are such tiny incisions. We wrap your leg up like a mummy with an ace bandage, have you walk up and down the hallway, and you can go back to doing your thing and wearing compression stockings.
Tell me a little bit about the facility. We can go back live now. Tell me a little bit about the facility itself.
So we have a very large office. We have 7 surgeons. We're either operating or seeing patients in that office.
You're at Baptist, Maine?
We work at Baptist, Maine, Homestead Hospital, South Miami Hospital, Doctors Hospital, and West Kendall Hospital. We also do some elective procedures at University of Miami Hospital. But, all of our patients visit with us hopefully before surgery, unless it's an emergency, and then follow up to see us in the office, which is, very close to here in Kendall. It's adjacent to the Maine Baptist Hospital. And we're doing procedures in there. We're evaluating patients before and after, deciding what everybody needs. It's a big machine.
And how many doctors are you?
So we're 7 vascular surgeons, and we have 5 physician assistants. But it's always the physician who's doing all of these procedures we just talked about. And there is one more procedure we haven't gone into, which is a thermal ablation.
So we have pictures, video of that?
We have a photo of this.
Yes.
So remember we were saying, well, what if you do have that underlying problem with the valve? It's all about the valve. What if the valves in your superficial veins are just not doing a good job? They're causing that backup and congestion. Instead of the blood traveling from your foot back to your heart, the blood says, well, I'm going to get off an exit ramp and travel through the back roads and go through neighborhoods and make my way back to the heart that way. And that's, again, when you see a lot of these big bulging veins, people have swelling, fatigue, their legs are killing them at the end of the day. So in that situation, we're going to consider a thermal ablation, where we put a catheter, it's like putting in an IV, in the vein in your leg, and we use heat to shut it down. And that is very efficient and works well to prevent more of these problems from occurring in the future. Half of my patients take a mild sedative in the office when we do this. The other half say, no thanks, I'm fine. We put a little bit of music on, we chit chat, and between 25 and 40 minutes, they're good to go.
Oh, that's amazing, and it's so nice to see that there's so much out there to make women feel, and men, comfortable.
And men.
So you think it's a woman thing. It crosses gender on this.
Absolutely. And I really do have a lot of male patients who are so grateful because it's allowed them to, have more energy in their legs to do their job, play sports, etc. And some of them feel ashamed because they think it's a women's problem, and it isn't. This affects all of us. It really does. And think about all of our jobs. I mean, no matter what we're doing, whether we're teachers, hairstylists, mechanics, construction workers, we really ask a lot out of our legs. We are often supporting ourselves for the majority of the day. So getting evaluated by a vascular surgeon, seeing if you have problems within these veins or not, and then coming up with the right prevention plan or treatment plan is key, because we're going to be standing for a while.
Thank God. And what I found very interesting is I didn't realize the trajectory of when you just get those little crawling little veins, and how it could progress to something much more, and how the discomfort. I didn't realize that was the timeline for these veins.
I mean, again, there are plenty of people out there with spider veins, and that's all they are. And I don't want them to be alarmed. But if we look with our ultrasound, we'll be able to figure out if they have the problem with the valve or not.
And that's really the more important aspect of treating, other than a cosmetics. And what if there is a valve problem? What happens?
So people, again, do tell me that their legs get swollen, they're itching, they're fatigued, heavy, tired. They're seeing way more, bulging veins. They're getting skin discoloration, kind of a tan colored. Their skin may eventually start opening up and forming ulcers, and they can really get into trouble. We actually participated. We were the only site in Florida where we implanted biomechanical valves into patients' thighs, into their femoral vein for the deep system, where those valves weren't doing a good job. Up until now, you and I have been talking about problems with the valves in the superficial vein system, because I'm able to ablate and shut down that bad superficial vein, and you'll be fine. 90% of the blood return in veins travels through the deep system, okay? But 90% of people's vein problems are due to problems in the superficial vein system. That's why we spent so much time talking about that. If you have a problem in your deep vein system, I cannot get rid of your deep vein. But with that study, we did implants in multiple patients, and we're following them along, and we're waiting for the results of the study to demonstrate if implanting a mechanical valve into your deep system can potentially help some of those patients.
Does this affect the heart? Is the heart ever involved with this?
This shouldn't necessarily affect the heart. I mean, eventually it could cause so much venous congestion that it does stress some of the heart, but everything is a pump in our bodies, right? So the legs have to pump the blood, back. Same with the arms. The heart is pumping the blood forward. The blood is getting filtered through the liver and your kidneys. So everything has some dependency on each other.
And talk about some emerging treatment options that we might not have talked about that are a part of your wheelhouse that you haven't disclosed yet.
I see. For sclerotherapy, instead of just hitting those veins with that chemical irritant we talked about, it's called polydocanol. We've now taken to mixing it with CO2 and creating a foam. It looks like shaving cream. It's not shaving cream. So we inject those, and it really travels a lot farther and does quite well. Again, we're doing, all kinds of phlebectomies for very particular patients. In the operating room, we do stripping of veins, but that's very unusual. I think the newest technology is what we just touched on, implanting these valves into veins, and we have to wait and see what the data shows if this will become a more common treatment for us or not.
That is just what a turn of events. How far you've come, right?
Yeah, I mean, listen, vein disease is challenging, and it's very frustrating for patients and for a lot of physicians as well. And not a lot of attention has been paid to it over the years. So it's very exciting that there actually are some studies and trials being conducted to try to make some headway here.
And you're in the forefront of that.
We are.
And for more information, it's miamivascular.com or 786-776-7866 for more information. On the time we have left, just something that we might not have talked about and touched upon that you want to share with our audience.
Well, first, I do want to piggyback on the phone number because you can text message us. We in our office always have a dedicated vascular specialist medical assistant, and that person will be available to answer your questions via text or phone call. And we really think it's important for you to have a way to streamline and reach us and, have a plan set up. The other thing I would say is my partners and I just love being part of this community, the one that we are part of. And it's really heartwarming that I've been able to return and practice here for most of my career, and I continue doing that for the long run. And please take care of yourselves. Go get some compression stockings. They're breathable materials, sexy materials, sporty materials. Give it a shot, and we'd love to help take care of you and the rest of our community.
And what else can one do? What about health, nutrition, exercise?
Good points.
The positioning of legs up against the wall at the end of a long day. I remember when I was pursuing an acting career in New York, at the end of the shift, they didn't have the compression stockings were like your grandmother, the great-grandmother, probably great-great-grandmother, sorry, grandma. Right. And up against the wall where your legs would, you'd have a reverse of the blood going away. Talk about some of the things that one can do to our audience.
Yeah, that brings up a good point. I want to mention compression stockings are to be worn during the daytime, not at night, because when you're at night, your legs are elevated, and that sounds like what you guys were trying to do. Gravity's on your side, and blood is then returning, by elevating your leg.
Up against the wall. It was up against the headboard at that time.
Yeah. So wear compression stockings during the day. Give your skin a breath or a break at night, or if you're just at home and you can elevate your leg on the couch or you're laying down, give it a rest. Of course, as we put on weight, it tends to put additional stress on those valves. So if you can try to be active and work out and shed a few pounds, that's only going to help you. Being active is important because in addition to the valves, the calf muscle acts like a pump every time you walk, and it's helping to squeeze the blood back to your heart. And if you are somebody who's working from a desk at home, please, every hour get up, walk around. It isn't just patients on airplanes who have these deep vein thromboses. This can happen to patients who are very sedentary or who are just not getting up and moving.
What is that? Tell us what that is.
A deep vein thrombosis is when blood clot forms in your vein due to stagnant blood. And that can cause scarring of the valves. So even if that blood clot resolves with a blood thinner or a medication, those valves can be injured and lead to everything we just spent the last time talking about. Deep vein thromboses are also dangerous because it's a blood clot that could break off and travel to your lungs and cause a pulmonary embolism, which could be fatal. So it's really important to prevent those blood clots. Blood clots in your superficial veins are not nearly as dangerous, but do require follow-up.
And I love that you're there for our community, and I love the opportunity of being able to talk to someone through a text message. I think that's really important in this day and age. We're all running around and busy, and no question is stupid or unimportant because you've heard it all.
Totally agree.
And better to err on the side of caution than having to deal with you in an ER situation or
That's
or
right,
beyond.
Fara. That's right.
And it's 786-776-7866. Last question. The most important moment in your career thus far?
Oh my goodness.
That was unscripted. I'll give him. It's miamivascular.com. You ready yet?
Let's see. Every time I save a life makes me feel purposeful and fulfilled. I do remember that during the COVID pandemic, we had a lot of people with blood clots, and we didn't know in the beginning what was causing them or why this was occurring, but it was. And we had a patient who was so ill. He had gone on an 80-day cruise around the world, got in COVID, and he was sick, intubated in a hospital, and everyone thought that he was going to die. And he threw a bunch of blood clots into the arteries in his legs. And we tried really hard to save his leg and were unsuccessful. And we had to do multiple levels of amputations. And I remember most people thinking, why are you guys even bothering? This guy isn't going to make it. He's moving on to the next phase. But we didn't give up. And we received some videos eventually, a few years later, of this, 80-year-old man swimming in a pool with a very high level amputation, and he's enjoying life. And I think that just tells me, I'm not the one to decide, how someone should or shouldn't live their life, or when to stop, or what to, everyone's different. And here is somebody that everyone had counted out who is now living his best life. And I want to allow all my patients to do that in any way that I can. So that was a really meaningful moment to me, getting that feedback from him.
Dr. Michele Taubman, you do God's work.
Thank
and
you.
we forget sometimes that you too are human too, that you all have feelings, but the work that you do and the relationship I've had with your practice, Miami Vascular Specialist, has been unbelievable, unparalleled, and continue helping our community, and for important and cosmetic, or more important and less cosmetic, whatever floats your boat and needs.
Whatever floats your boat.
MiamiVascular.com, 786-776-7866. I want to thank you again for joining me, and I want to thank you for joining me today on The Community Voice. Until next time, take care of yourselves and each other. Thank you, Dr.